Hello, my name is Dr. Santosh Abraham. I'm one of the consultants in endocrinology and diabetes working in a small town called Karikat near Thrissur in India. Previously, I worked as an endocrinology consultant at Scarborough Hospital in UK. So today I want to talk to you about what happens when you have diabetes and when you have another sickness or illness along with it. So let's say like you have fever and you are also having diabetes and you're on insulin, which means that you're already taking insulin. So what would you do in that case? So most people would think that if you are sick, you should stop your insulin, but never stop your insulin. Instead, you will have to increase your insulin dose. This is because when you have a sickness or infection, your blood sugar will rise. And since the blood sugar rises, it can give to other complications and also it can prolong the period of infection because basically your blood sugar, when it rises up, the bugs inside your blood can grow faster and can multiply faster so that you would have a longer period of illness. So when you find that you have got an illness, let's say like you've got a cough or you got a flu, you got fever or you got an urinary infection or you got pus or abscess somewhere, or even if you got a broken leg or something like that, and you are not well, and then what to do next is like you need to check your blood sugars more frequently when you find that you're ill. And if your blood sugars are really going high up, you need to increase your insulin. So if you're on a long-acting insulin or a basal insulin like Tigeo or Lantus or any kind of glargine insulin, you need to increase the insulin. Like if your blood sugars are between 100 and 200, you don't need to do anything. But if your blood sugars are going above 200 and if they're below 300 and you've given your normal insulin dose but it still goes on climbing up, you need to give an extra 2 units. And if it's between 300 and 400, you need to give an extra 4 units. And if it's above 400, you need to give at least 6 units. That is if you are taking Tigeo and if your blood sugar is between 300 and 400, you can, and if you're taking the normal dose of 20, you can increase it to 24. For those who are taking two kinds of insulin, like a Tigeo and or Lantus, which is a long-acting insulin, and a short-acting insulin like Apidra or Humalog or Actrapid, you can increase the short-acting insulin also in the same way. Like if your blood sugars are persistently high and you already have taken an increased dose of your long-acting insulin, but if they're still high and if you're taking a short-acting insulin, so if it's about 200 and if it's below 300, you can give an extra 2 units. If it's about 300 and if it's below 400, you can give 4 units. And if it's above 400, you can give 6 units. So that it will help to decrease your blood sugar, and at the same time it will help you to get cure. I mean, it will help you to get clear of your infection. And also you need to make sure that you drink a lot of water, at least 2 to 2.5 liters per day. And this could include any sugar-free fluid. But if you can't eat your meal, like if you got diarrhea and vomiting, just make sure that you have enough carbohydrates. So you can have ice cream or you can have any sugary drink, or you could have yogurt with sugar or whatever, just to make sure that you got enough carbohydrate in your system because you're already on insulin. And if you still can't eat, like you're throwing up everything, you can have sugar in the form of IV fluids. But never stop your insulin. That's the bottom line. That's the whole purpose of this video. And never decrease your insulin, but rather you might need to increase your insulin. And don't change your diabetes medications just because you're ill. Now, there are certain medications you need to stop if you are sick and if you're very poorly and if you're very unwell. These are medications which are used to treat blood pressure, and those end in pills. Like if you're taking enalapril or captopril or lisinopril, you may need to stop that for a while, because when you're having an illness, you probably are more dehydrated, and these medications could cause more damage to your kidney when you're ill, and you may restart it when you're free of the illness. Similarly, medications like losartan or telmisartan or candesartan should be stopped for a while, because this could cause problems to the kidney when you're sick. It doesn't mean that you have to stop permanently, but you can restart it when you are free of sickness. You may need to stop some of the medications as well. Like you may need to, if you're taking a tablet called dapagliflozin, you may need to stop it for a while. Especially if you've got ketones, you'll have to stop it for a while, and then you can restart it. So just to make sure that you shouldn't never stop your insulin, and you should do your blood glucose checks more frequently, and make sure that your blood glucose is maintained between 100 and 200. Thank you so much for watching this video.